My name is Patrick Scheffler. I'm a pediatric otolaryngologist at Cohen Children's Medical Center in Northwell. I treat the whole spectrum of ear, nose, and throat conditions in children, but I have an interest in treating disorders of the airway and the very specialized surgical treatment of obstructive sleep apnea, especially a surgery called slide tracheoplasty, which is not otherwise done in New York to our knowledge. I was born in a small town in northern Germany, and I just wanted something that brought true meaning to my life, more of a calling than a job. I just developed a love for taking care of children. We all stand on the shoulders of giants, and I was incredibly fortunate to have fantastic mentors at Stanford and at the Hospital for Sick Children in Toronto who trained me well and who prepared me for this. At Northwell, because we're at such a tertiary and quaternary institution, I think we have the responsibility to not just provide the standard of care, but to go beyond the standard of care and push the envelope and really not just kind of treat patients with what we know from yesterday and with yesterday's care, but figure out what defines tomorrow's level of care and tomorrow's procedures and really push the envelope that way. I think it's a culture of collaboration. We just all work together for whatever is needed for our kids. One of the most common things we treat, especially in our multidisciplinary sleep program, is what is called obstructive sleep apnea. And what that is a condition where something gets in the way of the child's ability to breathe at night. And in the short term, it affects their quality of life, their wakefulness during the day, their ability to learn and develop. But in the long term, it can affect their heart and lung and brain functioning. I'm very excited for our team to have grown the first and so far only multidisciplinary sleep apnea medical and surgical team in the state of New York. I think raising health is really about wanting to do just a little bit better every day and not being content with the status quo. But what I love the most are the day-to-day interactions in clinic. Like if you have a child who seems stressed and all of a sudden, they lighten up and you just have that little moment of brightness, that's what I love most about my job.